Soundbytes. Quick clips, long-term learning.
So this is a middle-aged man who came to the hospital, had a history of chronic pancreatitis, and had a history of a pseudocyst. At one point, he underwent a hepaticojejunostomy and came in with epigastric and right upper quadrant pain.
Okay.
So it looks like they're doing a fast exam here. So this looks like it's the right upper quadrant. Right upper quadrant view. See anything abnormal here?
Taking a look at the liver, looking at the kidney here. This looks to be normal.
Yeah.
Normal
Yep.
Morrison pouch.
Yeah, so we're kind of looking for free fluid, any kind of incidental findings in that area. We see the liver and kidney, a little bit of the diaphragm curving around here. But looks okay so far. Do a little bit more of the right upper quadrant. Have a little rib shadowing here as well, getting in the way, but overall don't see anything abnormal. And then they're including the liver tip down here as well, just make sure that there's no free fluid there. And then we get to some kind of more interesting findings. We have another view here. This is the subxiphoid view of the FAST.
Okay.
So we see the heart squeezing. Looks like the function's okay here.
All right.
Anything abnormal you see about the liver, this is sort of like the left edge of the liver that's just anterior to the heart right there.
Yeah, so within the liver space there, it seems to be these three bright white lines here, some hyper-echogenicity.
Mm-hmm.
That's not normal.
Yeah, I agreed. Yeah, so you see these hyperechoic densities here within the liver. So that actually is the appearance of air on ultrasound, but air within the liver is abnormal. So this is actually the ultrasound findings of pneumobilia. So why, though, do you think, based on the patient's history, he may have air?
So I guess for this individual with his history of surgery and the connection between the liver and the jejunum, there could be air, within the bowel that is backflowing or backing up into the liver, and to be expected, I guess, in this individual.
Yeah, exactly. So with the hepaticojejunostomy, there's some surgical connection made between the biliary tree and the jejunum, because there's some sort of obstruction elsewhere within the biliary system, so it needs to drain that way. So that air that's normal bowel gas within the jejunum can reflux, kind of retrograde up into the biliary tree. So that's sort of an expected post-operative finding in someone with a surgical history. You'd be more concerned if this is a new finding, or it's more diffuse, or the patient presents with concerning findings like fever, right upper quadrant pain, and sepsis type vital signs.
Soundbytes. Quick clips, long-term learning. This soundbite is a shorter, digestible segment taken from our monthly Soundcheck podcast. For the full episode, check out the podcast on YouTube at youtube.com/MedStar Emergency Physicians or visit mepsono.com.